Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Nurul Izzati, binti Ahmad Tarmizi. My matric number is 2112754, and today our group will present to you about the comparison of medical industry in three countries, which is Malaysia, Egypt, German, through training, payment system, and working hours and work-life integration. Before that, I will introduce you my team members. The first one is me, Nurul Izzati binti Ahmad Tarmizi. The second one is Azwantie binti Jamain. The third one is Muhammad Aiman bin Nazari. The last one is Suaidah Farhana binti Mat Yasin. So we continue to our introduction. Medical in the study that practice of health and healing. It consists of nurses, physicians, and other specialists. It addresses illness, diagnosis, treatment, and prevention, as well as medical research and many other areas of health. The link between HR and healthcare is extremely complicated, and it needs future research and investigation. HR technique must be established in both government-funded and employee-paid system in order to find the optimal balance of workforce and practitioner skills. And why SDG number 3, which is good health and well-being, are related to this topic, which is as you see to our topic, which is medical industry. So I think we need to make sure that in every country they have their own training, they have their own specific to do with their people who treat the patient in a good way. So I think this will be continued to the future.
Thank you, Brother Aiman. So this is my part, Government Hospital in Egypt Medical Industry. So my name is Suaidah Farhana binti Mat Yasin, metric number 2113436. So basically in Egypt, the primary source of healthcare for rural residents in the middle of 20th century was the local building, which is as the school, healthcare center, hospital, social welfare, and the agricultural extension station. So it started in the beginning of 21st century, which they booked hundred of hospitals and thousands of small healthcare to serve the rural areas. However, these rural residents seek medical healthcare at Islamic care institution instead, which were frequently better than those administered by the government. It is because due to the generally inadequate quality of government facilities. So there are a lot of highly skilled doctors actually, but it is more in the cities and larger cities. So since the importance of medical field is very important in Egypt, so medical schools only admit the best qualified high school graduates from the international and also locals Egyptian. So this is some of the example hospitals that serve for the Egyptians. So first is the government hospital. You can see here the El Sadat Central Hospital, Talca Central Hospital, and Al Mansura International Hospital. However, next is the University Hospital, which also governed by the government of Egyptian itself. However, it have the contribution from the university student. So there are Alexandria University Hospital and Cairo University Hospital for the outpatient clinics. And also it has Al Hussein University Hospitals. So first thing first, I will be explaining for the training and development in Egyptian medical industry. So they have two in common, compulsory Egyptian Medical Training Authority and Teaching Hospital Institute. So compulsory Egyptian Medical Authority is the authority that conduct for Egyptian medical license, which required for every medical staff in Egypt. So the Egyptian Medical Training Authority are responsible in accreditation of the medical profession and recognize the international doctors that want to be work in Egypt. So to certify in their country itself. So they will provide certificate and license of practice, and they need to renew in every each of the year. So next is Teaching Hospital Institute. So Teaching Hospital Institute includes 9 institute and 9 hospital distributed over the Egypt. So the approach of THI can be easily found in any other countries such as Malaysia also. So which is we call in terms of medical university. So this medical university in Egypt offers the Bachelor of Medicine, Bachelor of Surgery and BBS to the students. So this approach is the common steps taken by any countries. However, Egypt is known one of the country that offer a lot of medical courses such as dentistry in Alexandria. So the hospital were used for the study purpose and also for the research purpose, and give the serve for the Egyptian in medical terms. So next is on the acts and law related for this training and development. So decree number 151 of 2003 concerning on the rules and procedure regulating exercise of vocational training operation, which includes in the medical industry. And secondly, decree number 175 of 2003 concerning on the rules and procedure regulating vocational apprenticeship, also being used in Egyptian medical training. Next, moving on to the payment system in medical Egypt. So we can see here on the left the average salary under the Ministry of Health in Egypt. So the minimum wage of Egyptian in general is Egypt pound 2,700, which is effective by the 1 January and 2023, which this is also applied for the medical industry in Egypt. So the law or act related to this payment system is law number 99 of 2015, granting government employees special allowance, and then decree number 183 of 2003, organizing employment women in night work shift, labor code 2012. So for your information, in Egypt, they prohibited the women working in night shift. Okay, moreover, the working hour of Egypt medical industry. So the normal working hour is similar with the other countries, which is maximum of 8 hour per day or 48 hours per week. However, in Egypt, 42 hours per week is the standard. So it cannot exceed for 10 hours per day, and seasonal work usually work for 10 to 12 hours per day, which this is based on Art 80 level law. So doctor are normally work for 8 hours, 5 days a week in public hospitals. So working hours are typically more flexible in private hospital where doctors may be required to put in longer shift, including nights and weekend. So the Egyptian Medical Syndicate, the professional union of Egyptian doctors and dentists, has published recommendation for working hours and rest time for the medical staff, which is at least 24 hours of straight each week. So medical industry is known for 24-hour service, same as hospitality services. So this means shifts also include the night shifts. From sunset to sunrise, it counts as overtime. The wage of the night shift worker should not be less than the normal wage, which is can be added up to 70% of their normal day's wage. So this is based on Art 1 and Art 84 of labor law. So in the 8-hour period of working, a normal worker should have breaks to fulfill the welfare of them. So mentioned in Art 81 to 82 labor law of Egypt, the break should not be less than 1 hour. However, the amount of break can be changed determining by the type of the work, which is difficult or exhausting work. So after every 6 consecutive working days, the worker should have compulsory 24 hours weekly rest. For the case of working on rest day, the workers are entitled for regular wage. So they can claim their work day working on rest day in the next following weeks. So working in medical field in Egypt surely affect the public holidays that are given by the government. However, in Art 52 of Labour Law of Egypt state that the employees have the right to obtain regular wage plus with the double pay of their regular wage if working in public holiday. So as for Egypt, there are 13 public holidays that are given to the Egyptian as follows. Okay, for my part is the working hours for leave in Egypt medical industry. So basically there are eight in common. First is annual leave. So the standard is 21 days for one complete year service, 30 days for 10 years and above, or the workers is aged over than 50 years old, and there are leave in proportion, which is the workers who work for less than 1 year or more than 6 months. So it can be increased to 7 days, considering the employees engaged in hard and dangerous work or in remote areas. So the termination before claim and annual leave, they can claim their annual leave according to the balance annual that not being used. So secondly is the sick leave. So in sick leave, they must have report from medical certified, only payable up to 180 days, and they can convert annual leave to sick leave if the sick leave already have been used. This is based on Art 54 of Labor Law in Egypt. So the Egyptian can claim social insurance law, which if they have proven their record of sickness, which is usually the medical certificate. So the company need to pay them for 75% of their salary as their insurance. However, the period of 90 days and above, they can only get 85% of salary. So next is the casual leave. So casual leave is 6 day per year. So in maximum 2 days consecutive they can take for each time. So this casual leave is actually deducted from their annual leave. So next they have also study leave. So study leave for the salary of the employee, it is based on their discussion between the employee and the employer. So it does not define the duration by the government. However, it is allowed in the medical industry. So the next is, I think the most interesting is the pilgrimage leave. So employee who have completed 5 continuous year uh, can be can take pilgrimage leave for 1 month, and this is a paid leave. So it is only can be claimed once in a service period for the performing pilgrimage or visiting Jerusalem. This is based on Art 53 Labor Law of Egypt. So next is they have childcare leave, which is only for company that employs 50 or more workers. So below 50 workers, which is we call usually in Malaysia small medium enterprise, cannot give childcare leave to the workers. So it is 2 years maximum leave but without pay. So maximum they can get this childcare leave is twice during the service. It is to take care the children. This is based on Art 94 of Labour Law. So next is the most common in every countries in the world, which is the maternity leave. So maternity leave required to submit medical certificate and date of birth and where it does take place. So the Egypt give up to 3 months paid leave for the woman who have give birth, uh, 10 months and more service. So this is for the worker who work in 10 months and more. So it is applicable to 3 children in Egypt. So they also give benefit social insurance that worth for 10 months, which is the 75% of their per month salary. So Lastly, for the breastfeeding break, I think it doesn't have in Malaysia. So breastfeeding leave is basically for the women that have um, baby. They can get two times half an hours, which is 30 minute, which is 1 hour for nursing break per day. So it is for only long for 24 months after birth, and employing, so the employers that employing 100 employees and above are obliged to provide in-house nursery or find an adequate nurseries for the baby of the workers. So this is based on Art 91 to Art 92, a labor law of Egypt. I think that's all from me. Thank you.
So the next one would be the medical industry in Germany. Germany's healthcare system is frequently recognized as one of the greatest in the world, since it provides its population with universal health insurance coverage, a complete benefits basket, and relatively minimal cost sharing requirements. Public and private health insurance are the two primary segments of the system. More than 2,000 hospitals are located throughout Germany, and in Germany, 30% of hospitals are university hospitals and around 50% of hospitals are public. Then, private hospitals make up the other half, with 30% being non-for-profit facilities and the rest being for-profit. So, in here, we'll talk about the government or public hospital and also university hospital in terms of their training and development, also payment system and working hours. So starting with training and development in Germany, most health professionals have 3 years of occupational technical training after secondary school, leading to qualification or diplomas and increasingly university degrees, and can apply to state health authorities for professional title authorization after graduation. Then publicly funded facilities, usually hospital trained nurses, they earn a vocational training pay and practice-based training and inpatient hospitals. The 2017 Nursing Care Professions Act requires 2 years of combined generalist training for nurses starting in 2020, while medical and dental assistants are trained independently in a 3 years vocational program at training facilities and physician practices, including mandatory rotation and get a basic income. And then all member states must train midwives at university under EU directive. Next, moving to payment system. According to the Federal Statistical Office of Germany, in 2020, the average gross annual salary was 47,700 euros, or 3,975 euros per month. Individual salaries can vary greatly from this figure, as they are affected by factors such as age, seniority, industry experience, working hours, and geographical location. Working in medical field, the average net salary for a doctor starts around 60,000 per year, with a range of 61,000 until 71,000. However, this is considered as low because the tax in Germany is very high, with 40% charge of tax. They also have great healthcare benefits and many other perks. After that, some employers in Germany also offer additional remuneration in the form of 13th month, summer or Christmas salary. Last for Germany is their working hours. Germany is a very strict country on their working hours. It is to take care of their employers or workers' need. Most employees are only allowed to work 36 to 40 hours per week. However, full-time doctors in Germany work on average 56 and half hours per week. including all shifts and overtime. According to the survey, 26% of hospital doctors in Germany are working on a part-time contract. And of course, in Germany, they also include annual leave for them, such as sick leave, maternity leave, new parents leave, even care leave, which is for those who want to take care of their close relatives who is sick. However, every employees need to obey the procedure too. So I'll pass it to the next presenter.
Thank you to the previous presenter. So I will continue to the next topic, which is work-life integration. To speak of work-life integration, I believe that everyone is aware that medical industries is one of the busiest. They do not operate in accordance with an office's policies as to their organizations. Not only that, but medical occupation are also carried that need us to interact with people and provide services. I think these three countries have the same work-life integration, and everyone must be thinking that doctor, nurse, um, they are combined their work life and normal lives. So actually we can separate these two things in many conditions, and if separate these two things in their life, they will be more free and don't need to be stressed. In US, they have a research about work life integration and normal life, and the result we can see that nursing have depression because of their combined their work life and normal life, but this is decreased year by year because have people aware about this thing. And to relate back to work life integration in these three countries, I think they have a same work life and don't need to be compared, no need to be compared because of I think so as we can see in every country they have a nursing that have a same work life integration. Finally, to conclude of the three aspect, which is training, payment system, and working hours, and work life integration, we can understand that every work has standard that we must to meet. After doing this research, we compare that three business in three distant country, which is Malaysia, Egypt, and German. And we can see that actually they have a same training. They have a training. They also have a salary that they pay to the nurse, the doctor, and not to be compared that they have a same work life integration. Uh, work life integration, and I think to and this is also related to SDG number 4, which is quality education, because we need to search more people who want to take care about patient and educate more people in this world. I think that's all from us. Thank you for listening. Thank you, and assalamualaikum warahmatullahi wabarakatuh.